Hello friends. So do you think fat is always bad, or do you find it difficult to get rid of the unwanted body fat? So here we are to discuss one of the most common cosmetic procedures called autofat grafting, in which your unwanted fat from the certain areas of the body can be utilized in certain other areas of the body for better aesthetic outcomes. Autofat grafting or fat transfer or fat injection, as it is commonly called, is a minimally invasive aesthetic procedure in which fat is harvested from certain areas of the body, is processed and transferred to certain other areas of the body like face, breast or buttocks to add volume, improve the contour and texture, as well as for rejuvenation. So patients who have depressed acne scars or depressed chickenpox scars can opt for this procedure to improve the volume and contour of the face. Patients who have depressed post-traumatic scars, as in case of old depressed facial fracture scars, wherein the face looks depressed, and fat grafting can be utilized to improve the contour and quality of the scars. Patients who are dissatisfied with the contour of the breast or the size of the breast can opt for this procedure, in which fat can be utilized to improve the volume as well as contour of the breast. Weight loss, aging, and heredity can cause sagging and change in shape and contour of the buttocks. So, fat grafting can be utilized in such patients to improve the contour as well as shape of the buttocks to get a more youthful appearance of the buttocks. Fat grafting can also be utilized in certain patients who have loss of volume in the face in case of facial deformities with facial asymmetry or facial hemiatrophy, as in Romberg syndrome. It can also be used in patients with depressed areas of post-skin grafting. Fat grafting is also commonly used for facial rejuvenation for cheeks, forehead, nose, chin, under eye, jowls, temple, and lips to reduce the frown lines, as well as for depressed areas to improve the volume, as well as for improving the glow and texture. Autofat grafting is a day care procedure which is done under general anesthesia or local anesthesia with blocks. In this procedure, small 2 to 3 mm cuts are given in the natural creases of the body to insert cannulas to introduce the tumescent solution, which numbs the area, reduces the bleeding, as well as breaks down the fat globules. Fat is then harvested in syringes and processed to isolate the fat cells from the tumescent solution, blood cells, and oil. Depending on the requirement, fat can be utilized as structural fat, micro or nano fat, which is then infiltrated with 1 to 1.5 mm cannulas in the depressed scars or to improve the contour and texture in face, breast, or buttocks. Fat is commonly harvested from lower abdomen, buttocks, and thighs. Since the procedure is done under local or general anesthesia, it is a relatively painless procedure. Both the donor and the recipient sites need to be rested for at least 2 to 3 weeks. So patient may need to avoid certain vigorous activities and strenuous activities like walking, jogging, or gymming activities for at least 2 to 3 weeks. In case of face, patient needs to follow soft diet and avoid direct exposure to sun as well as dust for at least 2 to 3 weeks. In certain cases, patient may need to wear compression garments for at least 2 to 3 months to maintain the shape and contour. Out of the total amount of the fat that is infiltrated, usually 20 to 40% of the fat is absorbed in the body, and the results are usually seen after 6 to 8 weeks. So if the patient maintains weight, follows low fat diet, and follows the post-operative instructions and protocol carefully, then the results are fairly consistent and long lasting. So depending on the requirement of the volume, the type of scar, and the quality of the skin, patient may need single or multiple sessions. main advantage of autofat grafting is that fat from unwanted areas of the body can be harvested and can be used to replace the volume loss in certain other areas of the body. Also, as compared to other synthetic materials like silicone implants or fillers, fat is biologically stable and readily available in patient's body, has minimal chances of rejection, and gives a natural looking results. So like any other surgical procedure, some swelling, bruising and redness is expected immediately post procedure, which usually subsides within 4 to 5 days. For any further information, feel free to contact us at Prestige Center, and do like, share and subscribe our channel for more such informative videos. Thank you.